Have we been misunderstanding one of the most common women's health conditions for decades? Because what we call PCOS may soon have a completely new name, that is PMOS, Polyendocrine Metabolic Ovarian Syndrome. And experts say this shift could completely change how women understand their symptoms, how doctors diagnose the condition, and even how the treatment is approached in the future. Hi, I'm Dr. Pooja Ambati, clinical nutritionist and dietitian. And in this video, let us understand what exactly is changing, why experts are renaming PCOS to PMOS, and what actually happens in the body. So, for the years, the name Polycystic Ovary Syndrome created a very specific image. Most people assumed this is a problem where ovaries develop cysts. But the surprising part is many women diagnosed with PCOS don't even have ovarian cysts. And at the same time, many women without PCOS, so without the condition, they have ovarian cysts. So the name itself was creating confusion. In fact, doctors and researchers have debated this issue for years because this condition affects much more than ovaries. So, not only the ovaries getting affected, it also affects the hormones in the body, the metabolic processes in the body. It also impairs the insulin function. It also impact the skin, the mental health, fertility, and even long-term health of the heart. So, not only the ovaries, it also involves many other symptoms and it also affects many organs or organ systems in the body. That is why major international group of experts proposed the new term that is PMOS, Polyendocrine Metabolic Ovarian Syndrome. So the word polyendocrine highlights that multiple hormone systems are involved. And the next one is the metabolism, right? And the metabolic, the term, it emphasizes something extremely important, that this condition is strongly linked to insulin resistance and metabolic health. So, this is not simply a gynecological disorder, it is a whole body condition. Now, let's understand what actually happens inside the body, especially the women. Normally, during every menstrual cycle, several tiny follicles begin developing inside the ovaries. And think of follicles like tiny sacs containing immature eggs. So usually one follicle becomes dominant and it matures properly, and then ovulation happens and an egg gets released. The remaining follicles naturally stop growing. So this is what happens every month of the cycle. But in PCOS, the old term or whatever the new term is the PMOS, this process gets disrupted. Instead of one follicle fully maturing, many follicles get stuck midway and they remain small and immature. These immature follicles often appear as multiple tiny filled structures or sacs around the ovary. So that is what we can observe in the ultrasound. So we can see some tiny bubble-like structures. So these are the immature follicles. That is what we can see in the ultrasound. And that is where the old term polycystic ovaries came from. But technically, these are not true cysts. They are just immature or arrested follicles.